In this lecture, we're going to go over directional terms that are used in anatomy and physiology.
The etymology or origins of words in anatomy come from Latin or Greek.
The first term that we are going to discuss is anatomical position. Anatomical position, by definition, is standing erect, eyes forward, palms forward, and toes forward. The position of lying on your back is supine. The position of lying on your belly is prone.
Directional terms help reference body parts to one another. They come in pairs, and their meanings are opposites to one another. Let's take a look at the first pair of words. Towards the front is anterior. Towards the back is posterior. So for example, the nose is anterior to the ear, and the ear is posterior to the nose. Towards the head is superior, and towards the feet is inferior. So for example, the shoulder is superior to the knee, and the hips are inferior to the chest. The next set of terms orient the body in reference to the midline. Closest or towards the midline of the body is medial. Furthest or away from the midline is lateral. So for example, the ear is medial to the shoulder, and the wrist is lateral to the knee. The next set of terms describe how close or how far away a structure is in reference to the trunk. Closest to the trunk is proximal. Furthest away from the trunk is distal. So for example, the shoulder is proximal to the elbow, and the elbow is proximal to the wrist. Taking a look at the lower appendage, closest to the trunk is proximal. Furthest away from the trunk is distal. So for example, the hip is proximal to the knee, and the knee is proximal to the ankle. In contrast, the ankle is distal to the knee, and the knee is distal to the hip.